Hi, my name is Christopher Forrest. I'm Assistant Professor of Clinical Family Medicine and on full-time faculty here at the USC PA program, the Keck School of Medicine of USC. When I first started the program, I've always had a love of technology and started working with clickers, but that really wasn't enough. Our program evolved into iPad technology, and we started working with one-on-one with iPads with the students and converting our lectures into an iPad-compatible format. The next phase was trying to develop more multimedia incorporated into our curriculum. And one of the areas I was responsible for is this windshield survey as part of the behavioral sciences. To give a framework, the students were divided into groups and sent to different communities in the neighboring areas and told to discover what the needs were, not only medically, but with sanitation, with lifestyle, with education, with how many parks are in the neighborhoods. Are there enough services there to really create a viable life? And if they were to work there in the future, what type of things would they be concerned about for their patients? Now in the past, this windshield survey was done by students getting in the car, driving through the neighborhood, and maybe tasting some of the flavors of the city they're in, meeting with policemen or firemen, and just doing some interviews and doing some research online. The problem was, I was faced with the fact that they were sending in a 30 to 40 page report that was graded and ultimately filed away in a drawer where no one would ever see it. For all the work that they did and the things that they were discovering, there must be a better way to do this. So the next concept was to try to develop, to transition the assignment into a multimedia presentation. Have them do a documentary that could be later compiled into an iBook and put online for everyone to see. Not only would this be able to capture the stories that they've experienced on their windshield survey, things like their experiences of reverse discrimination going into certain communities that they thought were so strange to them, welcomed them with open arms and showed them their cultures and explained everything to them that they'd want to know. In one case, they went to an underserved community where they expected to hear about the people's struggles because it was so poor. And what they heard was the pride that these people had in their community, how much they had done with this community. And so not only would this allow our students to have their stories told at a public forum, but it gives the communities a voice. It allows these communities to be able to share with the world who they are, what they're proud of, what makes them who they are, and it gives them a voice.